So Carla, today we're talking about pigmentation. So we get three different types. Sunspots, sun damage, usually the brown spots on the face, hormonal pigmentation.
So I've seen it a lot in practice. One of the most difficult pigmentation disorders to treat.
To improve. Absolutely. And then the third one is, of course, your post-inflammatory pigmentation, which we normally see if you've burned yourself in the oven, like I normally do on the wrist. You know, that brown. We shouldn't be in the kitchen. We're not going to talk about it a lot. But let's talk about hormonal pigmentation first. So when we talk about hormonal pigmentation, it's very important to know that if there is a vascular component to the hormonal pigmentation, we treat it with light therapy or laser. Okay. But if there is not a red component, we would normally use other treatment modalities, like for instance
microneedling with your mesostatic depigment treatment that we've just brought in. Absolutely fantastic on hormonal pigmentation specifically.
Without the red component. So you would normally do a peel with a microneedling in one session, and that you would do a course of treatments once every 2 to 4 weeks for about 5 treatments with the mesoaesthetic products then at home, or any good product for specifically pigmentation. If there is a red component, treat that first, because it is like cutting off the supply to the melanocyte to make melanin. How do we treat the red component? We usually use the laser, the one that specifically treats redness selectively without harming surrounding tissue. So the one we would normally use is the DiVL on the Harmony XL Pro system. That's the one that we like, and even if there are small little veins, we would also add in the laser. And then the sunspots. So sunspots is almost, or the brown spots, that's almost the easiest one for me to treat out of the lot. Because with one laser treatment you can get a really, really good result on those.
And that's on the AFT laser, also on the Harmony XL Pro.
How does the laser know to only treat the pigmentation without harming the tissue that surrounds it? And it's such a beautiful, simple science. In the same manner that we attract all the colors from the sun when we wear black, brown from the pigmentation, the brown spot on the skin, will react selectively to green light. Brown has highest affinity for green light, and that's how it can treat brown selectively without harming surrounding tissue, without scabbing or causing scabbing. Okay, so normally, typically what I would tell somebody if I'm going to treat sun damage, we cover the whole face, we treat all over the face because we don't always see all the brown that is there. From the moment that we've treated, up till about the next day, the brown spots will go darker and then only improve over the next week. And we cannot talk about pigmentation without talking about the most important thing, which is
sunscreen.
And sunscreen, being responsible around the sun.
Every 2 hours, sunscreen.
Yes, that's the most important thing. That's a good start in the day to apply sunscreen.
And sunglasses as well.
Hat, sunglasses, sunscreen.
And don't forget your mask.
Yes, but sunscreen is the most important thing. By the way, post-inflammatory pigmentation does improve over time. It just takes time. 99% will be gone, or 97% actually by 2 years. It's just something that takes time. Super. It's lovely to talk about pigmentation.
Thanks, Bill.
Thanks to you.